when we evaluate somebody for allergies, we do skin testing typically. That is a method by which we can determine what you are allergic to. The common allergens are trees, grass, weeds, dust mite, cat, dog, and mold in most regions. We use a small amount of that allergen in liquid form, place it on the skin, use a device that is similar to a toothpick, and then make a prick through that, which then introduces it to the first layers of the skin. That develops over about 20 minutes, and then those reactions are read. If there is no reaction, we code that as a 0, and then we rank everything between a 0 and 4, 4 being the biggest reaction. Once we know what you are allergic to, then we design a treatment option for you. That usually begins with avoidance. Avoidance measures include keeping the window shut, the air conditioning on, changing the filters on a regular basis. If you have been outside doing any kind of yard work, running around the block, any type of exercise, we always recommend that you take a shower or bath before you go to sleep at night, to change your clothing before you go into the bedroom or into the common areas. Always keep the window shut and the air conditioning on during the pollen season, which in our area is spring and fall. And also, if you can keep the carpeting to a minimum, it is always helpful. For pet allergies, pet allergen is a lightweight allergen. It can float in the air for many, many hours, and so a HEPA filter may be recommended. You may also try to keep the pet out of the bedroom at all times if possible. Dust mites are little microscopic bugs that live in things like pillows, mattresses, carpeting, couches. Highest levels tend to be in your pillows and mattresses because they live off of dead skin that we shed into there, and can be in relatively high levels when there's high humidity. We always recommend a set of dust mite covers. These are special covers that go over the pillow, the mattress. They slide over top, they zip shut. You put your sheets and pillowcases over top of that, and then you leave them be. They act as a barrier so the dust mites are underneath and you are on top. So step 1 of any allergy program is avoidance. Step 2 are medications. Medications are meant to control the symptoms. They are not a cure. Medications typically include non-sedating antihistamines, which are generally the first line therapy for sneezing, itching, runny nose. They are not particularly good for congestion or for postnasal drip. Nasal steroid sprays can be added for congestion and drainage. Those include fluticasone as well as triamcinolone and mometasone. They can be used regularly, and it's also recommended to start them a week or 2 before the season begins in order to have a maximal effect. Nasal antihistamines also exist now. Azolastine and olopatadine are the 2 most common. They can either be used as standalone medications, or you can add them to nasal steroids to boost their effect. Lastly, allergy shots. Allergy shots are a way to develop an immunity to allergies. We would make an allergy serum. It takes several weeks typically to get that ready. Once it is ready, there's a build-up period. There can be 2 ways of building up. The original way, where people walk in, typically get an injection once a week, build up over about 6 to 8 months of injections until they reach their top or their maintenance dose. At that point, we spread the shots out to every 2 to 4 weeks, ultimately going once a month. Some offices may do cluster immunotherapy, which is a more rapid way of building up on allergy shots. Instead of coming in and doing 1 injection, people come in and do 3 typically at a time and build up over 8 weeks instead of 6 or 7 months. It is a faster way to reach your maintenance, although there's more time involved in each session, usually about 1.5 hours to 2 hours each time. Drawbacks to allergy shots. It is a commitment. You do have to get to the office at least once a week in the beginning. Monthly after that, we do hold people for 20 minutes after every injection to make sure there's no reaction, which can be a little redness or swelling where you get it. Rarely you can get wheezing, chest tightness, hives. We are injecting you with the things you are allergic to, so we keep an eye on that. But improvement rates, 90% of patients will improve on allergy shots. That is defined as at least a 75% drop in symptoms or the amount of medicines you would have to use for those symptoms. So it is a way that down the road, usually within 3 to 6 months, that people can get off of most, if not all, of their medications. And then the long-term benefit, once you stay on allergy shots for 3 to 5 years, can be up to 20 years in the majority of patients who are on them.